Next up is Scott Morin. Scott is a COM alum and also wait, I'm going to read it. He's a SMHC staff, and I'm getting out of here so he can tell his story.
I have to break character, if that's okay, Tara. The last time I was in this room, I was a medical student. That was 22 years ago. I sat every day in that back row in the very far corner where I couldn't be noticed. A woman sat right in front of that computer, who is now sitting right there, who would become my wife, who is now sitting next to my two kids. So that is a sort of a mind-blowing experience. So I apologize for breaking character. I also apologize for reading off some of my notes. But this was tough to write, so I felt like it would be easier for me to read it. I'm a pulmonary and critical care physician at Southern Maine Health Care right here in Biddeford. I've spent a good part of the last 2 years learning about and treating patients with severe COVID infections. And as you know, living with COVID in our community has been a roller coaster ride. After the arrival of vaccines in the winter and spring of 2021, we felt like we had turned a corner. Cases were down, and our lives seemed to be returning to normal. In July of 2021, the Delta variant took hold in Maine. In August, our hospital started seeing an uptake in hospitalizations and critically ill patients. By fall, we were overwhelmed. Every hospital in New England was filled beyond capacity. Surgeries were canceled due to COVID patients occupying surgical beds. I was working more hours than ever in our ICU. When I was not in the ICU, I struggled to keep up with our outpatient pulmonary practice. I found myself pleading with patients who refused vaccination. I tried to relate my own experiences caring for the sick. Our entire unit and additional makeshift ICU beds on the medical floor were filled with dying or nearly dying COVID patients who almost universally refused vaccination. Some were old and some were young. It seemed to spare only the vaccinated. To those who were vaccine hesitant, I may have convinced a few to get the vaccine. To many, however, my advice was met with indignation or hostility. One patient told me the vaccine was a creation of the eugenicist Bill Gates. Another patient told me the answer wasn't vaccines, but rather to prevent immigrants from bringing in the virus across our southern border. Most simply refused because they didn't trust the medical system. They didn't trust me. Meanwhile, in the ICU, I became increasingly distraught over the absurdity of watching people either die or have their lives destroyed over a preventable illness. Family members often blamed us for their plight. One daughter asked why her unvaccinated father couldn't be transferred to a hospital that could do quote-unquote more for him. She didn't seem to realize I had accepted him in transfer from another overwhelmed hospital that had no ICU, despite our own ICU capacity being stretched beyond thin. Through a feature called My Chart, family members can access the patient's chart. The same daughter asked why I wasn't correcting insignificant lab abnormalities that appeared as red instead of black on our computer screen. One girlfriend of a patient accused me of putting patients on ventilators for the money. Families of other patients often asked why I wasn't prescribing ivermectin. One day I sat across from a nurse being accosted over the phone by a family member. She told me he screamed, "You're the reason people are dying from this," before hanging up the phone. In December, I admitted a patient who was deathly ill. In order to preserve his confidentiality, suffice to say, he was dealing with a common condition that required a simple elective surgical procedure. Unfortunately, the surgery had been canceled several times because COVID patients were filling the beds normally occupied by post-op patients. There was not enough staff or surgical beds to perform surgeries. After several postponements, he developed an infection as a direct result of the delay. The infection was so severe, it resulted in multi-system organ failure. He died shortly after his admission to the ICU. I watched him hold his son's hand as he said goodbye. As I walked out of his room, I looked around our ICU at every unvaccinated patient filling the remainder of our unit and thought, they all have blood on their hands. I found myself coming to work angry. Anger is a dangerous emotion, especially for a medical provider. The sickest patients are often intubated, sedated, paralyzed, and placed on their stomachs for 12 hours or more. It is the only way to maintain their oxygen levels. While in this prone position, gravity pulls fluid into dependent tissues. After being flipped back over, the eyes are often swollen shut. Lips and tongues become engorged with fluid. Anger, combined with this assembly line of horribly sick and disfigured patients, had the effect of dehumanizing the very people I was supposed to be healing. It was around this time I met another young man being transferred to our ICU due to high oxygen needs. He wasn't vaccinated. He was argumentative with staff. He seemed incredulous that he was actually critically ill. His condition deteriorated, and anticipating respiratory collapse, he was placed on mechanical ventilation. Over the next several days, we struggled to keep him alive. His lung collapsed, requiring surgical placement of a chest tube. We attempted last-ditch strategies with a ventilator to improve his oxygen levels. He was placed in a medically induced coma to reduce his body's oxygen demands. Due to COVID restrictions, no visitors were allowed in the hospital. Every morning, I would call his wife and update her on his condition. After several days, she asked if she could call back in the evening. She was hoping his nurse could hold up a phone to his ear so his 7-year-old son could say goodnight. I'll remember that request for the rest of my life. I guess for every action, there is a reaction. Newton's first law states a body in motion tends to stay in motion unless acted upon by another force. I feel like an act of love by a boy for his father changed my emotional trajectory. It took almost 2 months, but our patient survived and eventually went home. After his initial convalescence, it took several weeks before he could talk. It took even longer to gain any semblance of strength. But as he recovered day after day, we got to know each other. He's a good man who loves his family. I hope he's doing okay. I'm relieved the little boy has his daddy back. I'm adapting. I'm tired, but I'm not angry. COVID cases are down, which obviously helps. In the end, I've learned some valuable lessons. People make decisions, sometimes unwise and ill-fated. It's not my job to judge. It is my job to love each individual patient and be part of a team that will make them better. The nurses I work with have shown me the way in this regard. I certainly have renewed love and respect for all my colleagues, but especially the nurses and certified nursing assistants with whom I work. They are an incredible group of men and women. They are collectively the epitome of selflessness and empathy. Thank you.